Very proud of both of you. Very honored to be here. And Dr. Melissa Durham, Associate Professor of Clinical Pharmacy. I like that title. You received your Doctor of Pharmacy, then completed a residency in community pharmacy practice, both at USC. You also hold a master's degree in academic medicine from the Keck School of Medicine of USC. Your areas of expertise include community, pharmacy-based patient care programs, and most specifically pain management, which I think is so perfect today because, as we all just saw from watching this film, pain is an underlying theme throughout everything. Before we start with the questions, let me just kind of preface the conversation if I could. People in 20 communities around the country have all just watched this incredible film. We have peer recovery groups, counseling centers, mental health advocates, youth groups, colleges, parents, and community members that have come together as part of a national day of awareness to highlight the need, most importantly, to destigmatize addiction, support people in recovery, and underscore the importance for community engagement and solidarity in the face of, it's truly a crisis, of our nation's opiate crisis. So, on that note, let me start and ask you, David and Nick, I read the statistic that I couldn't believe. Well, first of all, overdose, leading cause of death for people 50 and under, and 72,000 people died last year of overdose. So I wanted to ask you, being that you just have written memoirs a year apart, had them published a year apart, I should say, do you feel that the conversation in our country is amplified and it's more relevant today than ever before? Let me start with you, David, your thoughts about that.
Yeah. Well, first of all, I guess I'd like to thank you for honoring and thank Amazon Studios for hosting tonight and for making this movie. And we've worked with Amazon, and it's been amazing because they've been so committed to telling this story. But I guess most of all, I want to thank the people who came out tonight and who are here. Many people I know here are working in this field, which means that every single day they're saving lives, and we are so grateful to you. And many other people are here because of they've been impacted by addiction, and as we know, very few people have not been. Anyway, so thank you. And yeah, the fact that last year 72,000 people died is inconceivable. When Nick and I wrote our books, they came out 10 years ago, and the number was about 36,000, about half that. And at that point, couldn't imagine that it would get worse. And the fact that it has now, 200 people are dying a day. It is a tragedy. It's part of the reason that it's such a tragedy is addiction is preventable and it's treatable, and yet we are not doing a very good job with either of those things. So the fact that we're out here talking about it is really an important step forward for me.
Right. It's good, right? I just feel like people are more open about it, conversations are happening, and I have to attribute a lot to the film and to the work that all three of you have done.
All I'll say about that is that, yeah, people so often suffer this problem in shame. And so the fact that we know that we aren't alone and that we can come out together and talk about this is huge. It's a first step toward healing.
I totally agree. Thoughts, Nick?
Well, I mean, I guess the thing that we've learned is that addiction is an equal opportunity destroyer, right? Doesn't matter what cultural background you come from, what economic background you come from. Addiction really can affect anyone. And the fact that over 200 people a day are dying from overdoses is tragic. And the thing that's so frustrating about it is it feels like it doesn't need to be this way. Like it feels like there are things that we could be doing to be making a difference, like starting to raise awareness about different kinds of medications that can help, and getting overdose prevention medications in people's hands or reversal medications in people's hands. But
right.
it's not happening fast enough, and we've made progress certainly, but there's a long way to go still.
I think you're right, because I just heard something about even police officers are now armed with certain things that they can do because the epidemic is so prevalent that they almost have to know what to do right on the spot to save a life.
We met a principal of a school recently that
Wow.
of Narcan or naloxone. We met a principal of a school recently who was really resistant about doing addiction education in his school because he didn't want to sort of condone people using, and he didn't want Narcan or naloxone in the school. And then there was a boy who overdosed students had Narcan on them, and they gave it to the boy, and actually had to give it to him a number of times, but it saved his life. And so the principal, of course, changed his mind, and now is really encouraging education and bringing the Narcan into the school. So
great.
I mean, it's sad that it had to come to that, but great
Right.
that he was willing to change his mind.
I feel, Dr. Durham, like we've come a long way, have we? And what's your thought about this and the amount of conversation surrounding it?
Yeah, so, when we think about substance use disorder and just that terminology, converting it from the words addict or addiction or from substance abuse to substance use disorder, I think that's even just a huge stride that's happened recently.
Right.
Just the nomenclature and the words that we use to work to destigmatize this and treat it as an actual chronic illness and not a moral failure. And I think that there's been major strides made just in that area over the last several decades. I mean, if you think back to previous severe drug scourges in our countries, like the 80s, for example, it was total moral failure, is how it was viewed. And now, with brave people like you guys coming out and telling your story, and the work that many first responders and other health professionals and workers who work in substance use disorder we're making big strides in that.
Right.
I just want to comment too, since you guys already brought up naloxone. Okay, so that's the agent that is used to reverse opioid overdose. Just in recent years, we're in California right now. In 2014, we had a law passed where pharmacists, just at any community pharmacy, can prescribe and furnish it just to anybody.
Oh, is
We
that
have
right?
Good Samaritan laws to protect people, to administer it to anyone. You don't have to have a prescription. You can just come in and ask it, and you can get it.
Is it
And-
expensive?
Not too expensive. There's different products that are available, but many other states have similar laws. Just trying to increase the access to this life-saving medication and to just increase the awareness of getting it out into the public, because as you said, this is one of the biggest public health crises we've had in
No question.
modern
Next to
times.
homeless.
Well, one thing I was particularly, what I admire so much about the film, there were so many aspects of it, but I was especially impressed the way it didn't glamorize drug use. It was very realistic and it was heart-wrenchingly honest, but it didn't, and I'm sure that you must have had some input, but I really credit the director and the filmmakers of this too. It felt like there was, and the producers, I felt like there was a lot of sensitivity that went into telling your story the way that you wanted it told, and most importantly, to offer hope so that it didn't drag you down, but that you had a lot of compassion. I had a lot of compassion for your character, Nick, and part of that was the way that your character, David, handled it in terms of making me understand it was a disease. As you say, Dr. Durham, it's a disease of the brain, so you can't really fault anybody in this. But let's go back for just a second and talk about the glamorization or non-glamorization, I should say, and the amount of input that you had in terms of the film.
Well, that issue was huge, and in fact, it was very scary for us to go forward to let someone else tell our stories. It was scary enough when we did it, but we had control of our books. So we ended up meeting with these people quite a number of times and realized that they were really devoted to telling the truth. Addiction has been portrayed so often. It's either been glamorized or it's been very one-dimensional. And the thing that really strikes me about the portrayal here is we have this idea that people who become addicted are immoral. They're choosing to become addicted. And the truth is, no one becomes addicted. And the reason that I think the movie is so powerful, one of the reasons is because when you see the character who, Nick, Timothy Chalamet, the son, you never see that he's out there having fun. You see that he is in pain. And that's really what it's about. And that message is huge. It's so important because people who are addicted are suffering. And they need, instead of our judgment, they need our compassion.
And as a journalist, do you feel that because you had this background in journalism, that helped you in terms of kind of the research that you did and the way you got access to people? And maybe just talk for a second about this. And was there one or two things along the way that surprised you that you didn't know? I mean, you lived through it, but still, you had to almost separate your own personal experience from that of writing the book.
Yeah, no, I learned so much. I mean, I began where most people begin, which is, this is a disease, but it doesn't look like like a disease. So when Nick became addicted when he was very young, I thought, what happened to this child who I, knew? And I mean, this lovely person and this moral person, and suddenly he was doing things that people who do have this disorder often do, which include breaking into our house, just like in the movie, stealing from his little brother, who he adored and adores now. So the lesson, it took me a long time to get it, because I heard over and over again that this is a disease, which it is a substance use disorder. It's not a choice. I resisted it because it didn't look like it. It looked like it was a choice. Cancer is not a choice. Somebody does not make a choice. Well, now I realize that nobody chooses this as well. So it took for me, as a journalist, visits to some of the preeminent specialists around the world who study this, who devote their lives to it. And eventually I realized, without even, it's incontrovertible. We know this, and I think everyone needs to know this, because that shifts the way we think about people who are addicted, and it shifts our policies, and then it becomes all about how do we treat them.
Right, and Dr. Durham, is there anything you want to add to that? Because I think that's so profoundly important that we realize that it's not a choice. You're not having fun, you're not just out partying, and the slippery slope happened so fast. Even though you started, Nick, younger, it seems like that when you really fell off, in with, I guess, meth, that it was just quite a severe drop. And I'm sure there were times you wondered, will you ever come back? So I'll come back to you in 1 second, but Dr. Durham, do you want to comment a little bit on that?
Yeah, and I think that one of the reasons too that it makes it so difficult for people to understand is that it's hard to predict entirely who can try something and put it down, and who can try something and not put it down and take it to the next level, and so on. So I have experience with people I know who have dabbled and done this and that and whatever, and we're like, okay, I'm done.
Right.
Whereas others, many of my husband's friends, I won't name nameless, but took it farther and farther, and weren't able to stop. And we don't know what it is about individuals' brains that clicks, where they can turn it off or turn it on. And there's no way to predict it. There's no way to know. And I think that's another element that makes it very hard for people to understand, where it looks like a choice, but it's not.
I think that's fascinating, particularly the whole area of addiction. Think about it also in terms of food. Some people can be like, oh, I can have a bite of that, and others are like, they have to avoid it at all costs. It's just the brain, the chemicals in the brain, and the brain is such a crazy thing like that.
And now, we really do, this is a lot of the education I do, is trying to make people and healthcare providers understand that this needs to be treated like a chronic illness, just like diabetes or hypertension or any other chronic disease state that's so readily accepted from the healthcare community as something that just has to be chronically managed.
Right.
There's so much stigma still out there against the medications that we use to save lives, like Suboxone, buprenorphine, methadone. So there's a lot more work that still needs to be done, I think.
And Nick, I want to go back to you for a second. One particular part of the movie that I thought was just so tough to watch, but one of my favorite parts, and that's when you call your dad and you say, please, I want to come home, and he's just like, I can't do this again. And I want to ask you if you wouldn't mind commenting, because I'm sure that there's a lot of people out there that have had a similar experience where they have to just say, I can't do this anymore. I've done everything I can. What was it like from your perspective? And David, I want to ask you to talk about the way you did that.
Yeah, it really did happen like that. Very similar to that in real life. I called my dad, and I remember when he told me that he couldn't help me. I remember there was never a moment that I felt like he didn't love me, or that he really given up on me for real. I understood when it was happening that it was. Part of me, I was angry and stuff, and I wasn't getting what I wanted, of course, but I also understood that he was doing it because he did love me, and because it was what he'd been taught to do, and they were just I think I've really worn him down, I think, with my behavior, and we got really lucky though. Just in a lot of ways we got so lucky. The number of people who have done similar things, where they've sort of had to hang up on their child, and So I realized how lucky I got, and I think it is sort of a dangerous message that the film leaves people with, which it's not. I mean, it is what happens. So it's.
But I see what you mean, it's risky, but it can also be beneficial.
We
But it
got
depends.
lucky in that
You got
moment,
lucky.
but what we really, my dad could talk more about this, but I think ultimately what was the most helpful is for my dad, he really got to this point where it was like he wasn't gonna, give me money, he wasn't gonna bail me out, but as long as I was willing to get help and to go into some kind of treatment, then he would be there for me and he would help me to figure out a way to get into treatment. And of course that brings up a whole lot of other problems because treatment in this country is just a mess, and insurance doesn't pay for it like it should, and so many people don't have access to good treatment, and there's it can be so prohibitively expensive. But the fact that my dad was at least willing to sort of help me figure out a way to get help when I was willing to ask for it, I mean that really was sort of game changing for me.
Right.
But I don't know, you could talk more about it in a
David,
more educated way.
anything you want to add to that?
Well, the only thing, I guess what I would say, yeah, when I watched the movie, movie was obviously devastating. It was so hard to watch. It was a reminder of what we've been through, and somehow seeing it reenacted was just brought a whole new dimension. It was horrifying. The hardest part for me to watch was that scene that you're describing, because it was exactly what happened. And Nick's right. It was because I had just been broken down to the point that nothing had worked, and I was so weary. But this was 10 years ago that we wrote this story, and
Right.
it was reflecting on 10 years before that. And so we didn't know what we know now, which is when anybody gets involved in this world, I would go to family groups at rehabs, and I would go to one thing after the other. Therapists would always tell me that I had to sort of cut off my son, and I had to let him hit bottom, and I had to practice tough love. And as Nick said, we were so lucky because of all the people that we hear from who say, I did what they kept telling me to do. I hung up the phone. I shut the door. I said, no, I will not talk to you again. Go deal with this yourself. Go hit bottom was essentially what they're saying. And yeah, these kids or these wives or husbands or parents or whoever it was, they went out, relapsed, overdosed, and died. And it was, I think it's a really dangerous message, because once we know that addiction is a disease, we realize that we don't want people to hit bottom when they're sick. We want to catch them as soon as we can, because it progresses. There can be more consequences in their lives. It's harder to treat. So that message, I think, is really it's one that I think we really need to talk about. We really need to revisit. And this father wrote me, and I'll never forget these words that he wrote. He said he did that. He shut the door on his son because he'd been told over and over again. His son went out, died.
Right.
And he said to me in his note, he said, was my love tough enough?
Oh my gosh. Oh my God. So let me ask you, Dave, just a follow-up to that. As you said, we've learned a lot in 10 years. And with all the organizations and various people and groups that are watching the film tonight and watching us tonight, was there maybe something else in the film that you're like, hey, there's something else that I want to mention that maybe wasn't covered in the film? Because now you've done a ton of interviews, and I'm sure heard heart-wrenching stories just like the one you just said. Is there maybe something
Well,
else you'd like to share?
first of all, Daisy and Jasper are not blonde. They're 24 years old and 22 years old, and they've never been blonde, so I don't know where that came from, but I guess they just found these great actors.
They did.
But,
It kind of worked.
Yeah, but I guess the thing that I would say is that one of the aspects of the movie is this process of relapse and recovery. Relapse and recovery. We repeat that in the movie. I think it's, the doctor, played by Timothy Hutton, said it at one point, and the dad, Steve Carell, said it. Relapse is part of recovery. And we know that, first of all, it isn't always. Sometimes people go into treatment once and they stay sober.
Mm-hmm.
And it's remarkable, and of course that's what we want. But part of the nature of this disease, it is a chronic illness, and relapse can be a part of it. But also, part of our experience was, we don't know what would have happened if we had gotten better treatment. But part of the reason that I believe that Nick relapsed so often was because, we went to programs that just never gave him the treatment that he needed, that we now know is what works.
Right.
It doesn't, Nick has told the story that he's gone into a treatment program where when he broke the rules, They made him take a toothbrush and clean the grout between tiles as if that's treatment for a disease. So I guess that's the other message, is that I don't know if relapse has to be, relapse can be part of recovery, it doesn't have to be, and also it does not have to be multiple relapses, I believe, if somebody gets really good treatment.
Right, good point. Dr. Durham, anything to add to that?
I think that was beautifully said.
It was
I think
beautifully said, it's true.
Yeah, and I think just maybe to add, just to reemphasize what you guys were saying earlier about how the access to the substance use disorder treatment programs in our country is not where it should be at all.
Yeah, I wanted to ask you guys about that, because was it hard, David, to figure out where Nick should go in terms of a treatment facility? And because I read something that even some states don't even regulate this type of thing. Anybody can just, start a facility. So maybe there's some advice that you can give to someone that may be watching that's wrestling with this kind of topic of what to look for and how to avoid I imagine there's some phonies out there. How to avoid
There
that.
are a lot of treatments out there that are just terrible. They refuse, programs that really refuse to use what we now know as evidence-based treatments that actually work. And, again, I think that so many of our questions about how to deal with this disease go back to the fact when we remind ourselves it is a disease. What do you do if somebody's sick? You bring them to a doctor. So we want to make sure that the programs, therapists, whatever it is, that people are trained in addiction medicine. And then we're going to get the care that that people who are addicted deserve.
Yeah, I mean, then the problem is that the treatment centers are just so expensive, and that, like I was saying, they don't, a lot of places won't accept insurance, or for people that don't have insurance because they are addicted and they haven't been able to have, hold jobs. There are county-run places, there are scholarship programs, but there are not enough of them, and I mean, that's something that I feel like almost more than anything else, is something that I hope, a message that we can or we can just raise awareness about, that it's so important to figure out ways to help people get these kind of scholarships that they need to be in these pre-treatment programs that are evidence-based, and to have more treatment programs that are county-run, or that have beds that are county-run, so that people without insurance or people without, funds can get the help that they need, because there's no, I mean, it's unconscionable. It's like that we live in a society where, only people who have money or access to money can get help. That's like science fiction or something, but it's reality. It's really
It does seem,
disturbing.
it's hard to believe that this year, 2019, that still exists.
Yeah.
In the treatment programs, because I want to go back, you said something about your brother and sister, Daisy and Jasper. In the programs, do they talk about the family dynamic and the effect it has on siblings? And I'm particularly curious how your siblings are doing, how this affected them, and how was it when you saw the film with them?
Yeah, I mean, that, to me, of all the things that I did as an active, I know that I'm not supposed to say addict, but I'm so used to it that it's not gonna happen, so I'm just gonna keep calling myself an addict. But as an active, addict, what I did, so many unconscionable things, and I am, I really do regret a lot of my past, for sure. What I did to my family, my dad and my mom and my stepmom. But really the thing that I am the most sorry for is the way that I treated my little brother and sister, just because they were such innocents. And I remember, I mean, everyone was innocent, but I just remember when my little brother was born. He was the older one. He was born first, and I just wanted so badly to be a good influence on him and to be a good role model and just a good big brother. And the same when my little sister was born. And so the fact that I could go from that to just, really traumatizing them and being this force of fear and uncertainty in their lives, is really devastating for me. The amazing thing, and it's not just true for me, I've seen it with so many, thousands of people that I've met all across the country, is that it is possible to repair those relationships. It can take a long time, and it has to be done in the right way and slowly, but there was a period of time where I was actually newly sober, and I didn't even want to have a relationship with my little brother and sister, because I didn't want to get their hopes up again, that they were gonna sort of be kept close to me, and then I was gonna screw up again. So I waited a year almost before I reached out to them again, and then I started slowly, like with some emails, and then we talked on the phone, and then we finally met in person. And the fact that now, 10 years later, with like my dad was saying, Jasper's 22, and 25. Jasper's 25. The fact that we really are like best friends now.
That's great.
And, yeah, Jasper lives here in LA, and we see each other all the time. And my little Daisy is like one of. I mean, really, we talk on the phone every day. I mean, I'm so grateful for our relationship. But it took a lot of time and a lot of.
But they understand.
Yeah,
It goes
because we
back.
talked about it a
Yeah.
lot. I mean, and when I saw the movie actually with Daisy, and it was super hard. But she's not a very emotional person. But then it was actually the next day that I was just walking with my dogs at UCLA when she was going to school there, and she came down just to say hi to me and my dogs, and she just burst into tears. And I think that was really the moment where, I don't know, it was just so touching to me, because it was like, I think we just could see, it was like, this is how far we come, was if there we were, just walking our dogs together, she's at school, I have, a great life here in LA, and, just
But
so.
I have to say, I
Yes.
think the way you came through it and the inspiration that you've become in the work you've done, and I know it was hard, I think that's what helps repair those relationships. It wouldn't have come about if you hadn't done the work and made sure that it happened.
Yeah,
So
and
I credit you for that.
Oh, well, thank you. And being really I think it's important just to be really open about stuff. I mean, that's sort of the most important thing, I think. Instead of sort of just kind of glossing over it or trying to pretend it didn't happen, or just to really, really talk about it. And I know my dad can talk about this, but there was a point I know where he took them to a therapist when I was like out on the street and had disappeared, and they were, just little still. I mean, they just still in like grade school. And the therapist talked to him about this idea of ambivalence, where you can love someone and even, look up to them and worship them, but you can also be afraid of them at the same time, and you can kind of hate them even, or be really angry with them. And it's okay to feel all those things at the same time. And I think that was really kind of a breakthrough for them, and it was really,
That's good.
great.
And it doesn't mean you don't love them. It just means that you're conflicted in a lot of different
Yeah,
ways.
you can hold all of that at the same
It
time.
can be that way with your parents too. Before we come back to you, David, about that, I want to ask you, Dr. Durham, treatment facilities, what Nick was talking about. Are there some innovations that are going on now? Some certain things that you may have seen in the last few years, particularly with people at risk or those in recovery? Tell us some of the things that are happening now.
Well, one of the things that's happened is the funding that's starting to funnel down into these treatment programs through some of our government initiatives, through SAMHSA. I don't know if we've seen a lot of that come to fruition yet. It's very early. So one of the main points of the 5-pronged approach that we're hoping to address the opioid crisis is putting resources into prevention and treatment and recovery. So, you mentioned earlier, a lot of these facilities, maybe not a lot of them, many of these facilities don't have trained medical staff. It's kind of not a proper place to treat a disease. But we're hoping to see more emerge with the government funding that's being put in place.
That's good.
Yeah, and if you look at the 5 sort of areas that they're looking to focus, it's better data, research, better pain management, better, as I mentioned, the prevention and treatment and recovery. And that first one is really where the resources need to be focused.
The prevention?
The prevention, treatment, and recovery.
At a younger age, I imagine. I imagine we're skewing younger and younger. Am I correct on that?
Perhaps.
Yeah.
If this is, this affects younger people more than older, but again, you don't want to just assume across that it's a young person's thing only.
Right.
But.
As you said, Nick, it covers everything, right? It's the
Yeah, equal
addiction,
opportunity
equal opportunity destroyer.
Yeah.
And we talk a lot to our healthcare students and a lot of the healthcare professionals that I educate is what does someone suffering from substance use disorder look like? What does an addict look like?
Right.
And people conjure up all kinds of images in their brain, but honestly, like, it could be me,
Anyone.
it could be you, it could be
Totally
you.
right. And
Yeah.
affects, as David, I want to ask you about this. It just can affect anybody at any time without any real warning. And so I wanted to ask you just to comment if you could and kind of bring it home for us and let us know, is there the power of movies is so strong. So what's one thing that you hope that people watch that they take away from this and offer a little bit of advice for those that may be going through something?
Well, I guess the first thing I'd say, and we know, from experience It can be hell. Get support. Don't give up. It can be it's a roller coaster. So to hold on. I guess that's the main thing is sometimes we feel like we have to deal with everything by ourselves, and we feel like we're alone. Come together. Here's a good example tonight, and in the movie theater where we're sitting. I mean, we look around the room. I mean, there are so many people who are affected, and we're all in this together. It is a crisis that it's the #1 crisis in our country right now, as far as I'm concerned. And if we all get together, if we all work on this together, we're going to reverse the trend.
Right. And I just feel like with people supporting us and being advocates, the word gets out there. I mean, you were so lucky. Timothy Chalamet, one of the best actors in the world, playing you. It's Steve Carell, one of the finest actors today, playing, and a great director. And I just think that, as I said before, the power of movies is just so important. It will start the conversation going in a way that maybe didn't happen before. And before we close, I wanted to ask you, as I mentioned at the beginning, you've done a ton of interviews, been in a million articles, and I noticed that you also had an appearance with Oprah. So if you could just tell us what it was like meeting her, and how did she embrace you and this topic in such a meaningful way?
I'll just quickly say,
Yeah.
she told me she wanted to adopt Nick.
She did? She was ready to just take you in?
She was amazing. I was so nervous. I didn't even think I was going to be nervous, but then like walking out on stage, I feel like seeing her like come towards me, I couldn't even hear myself talk because my heart was beating so loud. But she was amazing, and that is a really cool thing about this. Oprah is amazing, but just that there is I think it's important to just say that there is so much hope out there, and it's not just for me. I mean, because the things that really make my life beautiful today are not any of the external things. It's really the internal. I mean, the way that I kind of can wake up in the morning and feel joy about just sort of the little things in life. And it's not just me. It's like I said, the thousands or millions of people all across the country, but the thousands of people that I've met who have these incredible lives that now that they're sober and they've been able to just really sort of thrive after getting through this total hell. So the fact that that's possible is amazing.
Well, thank you guys so much for being here. Thanks for everybody that watched this amazing film. And I just want to thank you for all the great work.
Buying food, you want the best I need.